So realistically, the workup of a headache, right? If you have a headache, there are different types of headaches. So some people have cluster headaches, some people have tension headaches, some people have migraines. So depending on the location that you have the headache, the characteristic of the headache, and the frequency of the headache, whether or not you have aura or not, I mean, you have a funny taste in your mouth, you have a funny smell, that tells a clinician, hey, what type of headache does this person have, and whether or not this is a migraine. But in the workup of a headache, if they give you a trial of medicine and you're relieved, then we know that that's usually not IIH. In the workup of a migraine, usually people have unrelenting headaches with the typical medication used to treat headaches. So NSAIDs usually. So you get no relief with Tylenol, you get no relief with Motrin, you get no relief with Toradol or Tramadol. And so then we're looking at, hey, is this a migraine? And usually migraines can be associated with some things. Some people have photosensitivity, people have associated nausea and vomiting, people have aura, meaning they can have funny tastes and smells. Usually we see that typical with a migraine. Now, the workup for a migraine usually excludes, meaning rules out IIH. So if you go to a neurologist and they're working for a migraine, they usually are going to do an LP and also recommend an eye exam. If you have a thorough workup and you've actually been diagnosed with a migraine, they've ruled out IIH as the etiology of your migraine-like symptom. Okay, so a lot of people say, I have a migraine because they've heard somebody else have a migraine or they've read about migraines, but they haven't been formally diagnosed with a migraine. So a lot of patients say they have migraines, but they've never been formally diagnosed. And so that population that has not been formally diagnosed, meaning they have not had an eye exam and have not had an LP to rule out IIH. Yeah, there's a subset of those that probably do have IIH. I particularly don't know the percentage of those people that have not been diagnosed with IIH that actually have been inadvertently told they have migraines, but I'm sure that you probably have a large pool of people that assume they have migraines that don't.